Welcome back, everyone, to OpenLine, talking about prisons. What is happening inside our prisons here in Tennessee with two people who are fighting for prison reform, Jeannie Alexander, Alex Friedman. Happy to have both of you with us. As we went to break, I said I wanted to drill down into what your biggest concerns are when it comes to our prisons. Healthcare is a major one, right?
Mm-hmm. Yes.
Alex, what about healthcare?
That's probably the largest issue in both medical and mental health care in prisons. So, you know, as a result of being tough on crime and enacting some very lengthy punitive sentencing laws back in the 80s and 90s, you've had prisoners that have been in prison, you know, for 10, 20, 30 years. And as they get older, as they age in prison, their medical needs increase. And so right now, medical costs are one of the largest budget items for departments of correction, including in Tennessee. And the amount of money it takes to provide adequate medical care. Now, first, I think I need to address this because people have this conception that, well, why should prisoners get free medical care anyway? Because, heck, I have to pay for medical care, or at least my insurance company does, and I have to pay premiums and so on. You know, that's one of the few constitutional rights that prisoners, at least allegedly have, is the right to adequate medical care for their serious medical needs, and that's kind of the terminology the courts use. So if I get sick or if I fall down and break my arm, I can go to the clinic or call an ambulance, go to the emergency room. I can see my doctor. I could go to the Minute Clinic at Walgreens. I could do a lot of different things to get medical care. Prisoners have none of those options. They can't do it. They're locked up. They rely entirely, completely, 100% on whatever care is provided by the jail or prison where they're housed. So that facility then has a constitutional obligation, a requirement to provide them with medical care because the government has taken away all other options. You know, they can't call an ambulance, they can't go to the hospital. So that's why they have a right to at least minimal, adequate medical care for serious medical conditions. Right.
Well, and
but this is expensive.
Yeah, and even aside from minimal, even the Department of Correction says that they are entitled to the community standard of care. That's what they claim they offer, is the community standard of care. Yeah, and so I think, as Alex alluded to, we are seeing a greater need for care because of increased sentences, right?
Right.
Mid-1990s, truth in sentencing happens in half of the states in this country, and now we have people who continue to remain in prison after they would normally have received parole prior to that, you know, and sometimes long after with double and triple sentences. And the result of that is, so for example, the ACLU predicts that by 2030, 1/3 of all prisoners will be geriatric. So if it's $30,000 a year to house and care for
a healthy
prisoner, we know that that at least doubles once a prisoner reaches an age of being considered geriatric. Now, because of reduced life expectancy, that's between about 50 and 55 for prisoners. At that point, you're geriatric, and at that point, you can just about predict that that prisoner's care is going to double.
So long sentences, health care, what did you see as a clergy when you were there, and what are you seeing now as far as the health care?
Right. Well, the same thing. Very much the similar things. You know, it's so often a failure to treat. You know, Alex referred to people saying, well, why should they get health care? Maybe I don't have it, or I have to pay for it. That's a presumption that there is health care. And when there is health care, how often is it adequate? So I worked with a number of prisoners, for example, who suffered from cancer or from hepatitis C. I was with prisoners who died from their diseases because they failed to receive treatment.
Is it worse, would you say, in a private prison or in a public, you know, a TDOC prison, or are they the same?
Say it's worse in a private prison.
It's definitely worse in a private prison. There are serious issues in both prisons, and we could use hepatitis C for an example, but it is definitely worse in the private prisons.
Also, just to interject, when we're talking medical care, diseases, broken arms, and things of that nature, but really mental health care is another huge factor. So this actually goes back to the 1980s and when we deinstitutionalized mental health facilities and basically put people back in the communities who had mental health problems, because the theory was they could be better treated back in their home communities rather than in secure forensic type mental health hospitals. The problem is we didn't provide funding for any of this community-based care, and so you had mentally ill people who then started bouncing from the streets back into jail, back to the streets, jail, streets, prison, streets, back to prison, and so on. And our mental health facilities now in the United States are really our prisons and jails. Our criminal justice system is our de facto mental health system in the United States. And pretty much any corrections expert or official or administrator will agree with that. And they will agree that they are terribly ill-equipped to handle this type of population.
They're not trained for that, right?
Well, prisons are prisons. They're not mental health facilities. And yet, the best estimates I've seen are a good 20% of prisoners have serious diagnosable mental health conditions. And a lot of the reasons they're in prison is because of their behavior due to their mental health condition put them there. But we're dealing with them as criminals based on their behavior rather than on their mental health needs as a patient. And these people do not fare well in prison. Of course, they get worse. They decompensate. They're not adequately medicated. And even if they are, once they get out, that medication is discontinued. And then the cycle begins again. So this is another huge, huge problem in our criminal justice system, is really the criminalization of the mentally ill.
All right, let's go to Vivian. Hello, Vivian.
Yes.
Hi, go right ahead.
Hi. I was saying that the criminal justice system here in Tennessee really does need to be revamped, because I have a son who is currently incarcerated out on Harding Place, and of course there are two different facilities out there, and so he's in the TDOT facility, and the issues that you have brought about, speaking of the mental health issues, that is a biggie, because my son is bipolar. And from the time that he got locked up last year, I had been asking around different places, different people, can they see to it that he gets his medication? But nobody will take him to see the physician. He got hurt out there one time, and he had to be taken to emergency. And when he came back, they did not follow the doctor's orders that the doctor had given, had instructed them to as far as his medication. They took his medication away from him and said that he couldn't take that kind of medication because it was scheduled.
Right. So he's bipolar? Okay.
A lot of things that...
Yeah, we get so many calls at the station about these kinds of things. It's overwhelming. All right, so what do we do? I agree. Prisons are now, I've heard up to 30% are suffering some kind of mental illness.
Yep.
What do we do? How do we change this?
We provide care. We provide mental health care. We provide medical care. And for the person who grumbles about the cost, that is a very short-sighted perspective, because we'll incur greater costs further down the road.
You're going to pay
if we
one
don't
way
treat.
or
one
the
way
other.
Or the other.
Yep.
And if you treat now, if you had sufficient, adequate, if you had a truly therapeutic environment, right? If we aren't just treating with medication, if we're trying to understand the root causes of why people act out in the first place, if we seek healing, if we seek to work with people to restore them to communities, in the long run, our communities are going to be safer, they're going to be more productive. So paying up front for real programming, adequate programming and care will pay off in dividends in the end.
Yep. Basically, stop criminalizing mental illness, right? I mean, if people are mentally ill, then provide them the treatment and services that they need to deal with that illness. We kind of treat mental health problems as some kind of, non-medical issue. If I have a broken leg, I would go to the emergency room, they would treat my broken leg. But if I had a bipolar disorder, I should be able to get treatment for that just as easily with no stigma attached at all. It's simply a different kind of medical issue.
Everybody talks about when we close the institutions. Does this mean we need to reopen institutions? Is that what we're talking about?
Different institutions, yes. So for the mentally ill, mental health facilities that are designed and intended to provide the mental health treatment services those people need. For people who have substance abuse addictions and alcohol addictions, those problems could be much better treated in a substance abuse treatment facility rather than prison. There's virtually no real substance abuse treatment happening in prison.
All right, we have to take a break. We have a bunch of calls, so if you're on the line, hold on. Tanya, Marilyn, others, hold on. We will get to your call. Take a break. Be back right after this.